What's up, guys? Ryan Malargic, jacked for Jesus. Today's topic, why you should not trust your healthcare provider. Why you need to do extreme due diligence before you take your healthcare provider's advice. Especially when they are prescribing antidepressants, drugs like Prozac, Zoloft, even, ADHD medications, Adderall, Vyvanse, and then, for heroin addicts, Suboxone. Guys, there is no difference between, we all know that drugs are bad for us, street drugs are bad for us. Pharmaceutical grade, prescription grade drugs are bad for us as well. And leading this into the battle, guys, let's face it, there's a battle between good and evil taking place right now, guys. My channel is jacked for Jesus. Okay, Satan is working through these medications. We have our legal system has given a human being, a susceptible human being, the authority to prescribe medications to patients, essentially street drugs that are now called prescription grade drugs because they're prescribed by a doctor, so it's seemingly okay. And now, since someone is saying it's okay, we just take them, without thinking twice about them. But let me tell you, you cannot live a normal life being on these compounds. It is completely impossible. I know individuals who are taking all three of these. I know individuals who were addicts. They were trying to become clean, doing very well, extremely well. And then they go to a doctor because they're not feeling the best, and they prescribe Suboxone, Vyvanse, Zoloft. Now, guys, Suboxone is an opioid, works on the same receptor as heroin. So what is this going to cause to happen? A relapse. It's inevitable. The brain cannot recover itself in 3 months. It usually takes about 9 months to a year for a brain to recover itself from drug addictions. and so, the Vyvanse, dopamine receptor agonist, similar to methamphetamine. What's that going to cause? A relapse. And then we have the SSRIs acting on, the serotonin receptor, which gives you the feeling of contentment. Okay? So now our natural compass to navigate our life cannot work properly. The natural compass that tells you to get out of bed, to go brush your teeth, to go to work, to get money, to lead you to being able to afford a house, to take care of yourself, to have somewhere to live. Normal day-to-day things that people need to be able to do to be able to take care of themselves. Thinking long term into the future, you know, for your best interest in mind. Okay, so if you're just taking a SSRI, that alone can throw off this natural compass. I see it countless times out in real life, and it's just a simple fact of the science behind it. If you can combine all of these compounds together, your natural compass doesn't work. You have no empathy. You have no emotions. How are you supposed to treat people correctly and navigate life? And as you can see, if this is, you know, on a scale of millions being prescribed, you're throwing human beings out into the world, taking away their empathy, lack of emotion. The downstream effects of that alone is going to cause a problem with society, guys. So in my personal experience, I've had numerous problems with doctors prescribing or not being able to figure out my own family members' issues, diabetic problems, mental health issues, and whatnot. And, you know, as I dive into the research of these compounds and the receptors that they, you know, work on, and what those receptors are designated to do for the human body so it can survive and coordinate its life properly with the minute-to-minute choices that it makes, hour-to-hour, day-to-day, month-to-month choices that it makes to be able to establish a life for itself. But, you know, with that being a problem, I just want to kind of steer it back around to how Satan could very well be behind having this kind of power to control human beings' lives, guys. The whole, I'll make a video on this, but the whole healthcare industry is completely messed up, guys. It's completely all about money. Like health insurance is set up just like the government with taxes. Let's have 1,000 people pay a premium per month, just like you pay your taxes, so that we can jack up the price of our pharmaceutical drugs, our prescription drugs, so that way we have 1,000 people paying for it, because 999 of them won't need the medication. The one person that does will jack the price up and have everyone else pay for it, just like taxes. But anyways, guys, the point is, as you know, we are following our journey with the Holy Spirit, we have to be aware that there is the opposite end of that, Satan and demons getting in people's minds. And you know, when you prescribe someone medications like this, you're making them dependent on the medication, and they're not dependent on the Holy Spirit. They're not as dependent on God and walking with God. So it's already taking them away. And isn't it just something else that our legal system has given, you know, granted that much power to one person to prescribe these things? Amazing. Anyways, guys, that's just my take. You know, granted, you know, I am no health expert. I'm not a pharmacologist or anything like that. But I have, you know, researched this kind of stuff for the past 11 years. And I have seen dozens and dozens of examples in my own life. And, you know, I know how these compounds work and how these neural pathways and these receptors have to be able to reset these neurotransmitters properly for you to feel okay, to have proper emotional responses, and to navigate your life. So if you are taking some of these compounds, I can't say I recommend, but take into account what I have said, do your own research, do your own due diligence, and put God first. Pray, genuinely pray, and see what that can do for you first, guys. I have seen miracles happen in my own life where we had alcoholics, drug addicts, individuals on depression medications. I have seen them find God and literally not need those things anymore at all. Like, pray, in a few days later, like, they were okay. Guys, that is absolutely amazing. You can't tell me that things like that just doesn't make you want to give it a try for your own self. But anyways, guys, that is today's topic. Please like and subscribe to this video, and have a great day. I do want to add this to the video, guys. If you are suffering from anxiety and depression, your first mode of action should be to assess your life, because anxiety and depression are just, they're alert systems to let you know that something in your life you need to take action on to correct it. But if your life is seemingly okay and you're continuing to have anxiety and depression, there are literally gene mutations that you can get tested. One of them, known as the MTHFR gene mutation, it is a gene mutation that actually over 50%, or about 50% of the population has this gene mutation, and it prevents the conversion of folic acid into the production of neurotransmitters, dopamine, serotonin, and epinephrine. And if you're not manufacturing these neurotransmitters, you will not be okay. Like, you can have extreme downstream effects, guys. Digestive problems, acne, skin problems, hair problems, memory problems, and obviously low energy, anxiety, and depression. And so usually when there is something going on with the body that needs a pharmaceutical med, that medication is just covering up the root problem. More likely than not, the problem can be addressed with nutrition, exercise, and in some cases therapy as well. But that combination of those three will 99.9% of the time fix your problems, okay? Because a couple examples in my life of doctors prescribing medications to certain individuals, one of them being, because we all are supposed to trust our healthcare provider. One example, someone was prescribed prednisone, an anti-inflammatory medication, and over time that medication cut off blood circulation to that patient's hip, and they had to get their hip replaced. Both hips had to be replaced, okay? And you can't tell me that these doctors did not know that. That's why I don't trust them, because they're prescribing medications. They could just be trying to make money and then causing more work for themselves in the future. Now they're getting to replace a hip. Okay, guys? I've known patients, the diabetic patients, who have been going to a doctor for the past 20 years, and their doctor could not get their blood sugar, under control. Guys, I'm straight up in the office, with these doctors, and I'm like, why can't we combine this long-acting insulin, Trulicity. No, Tresiba. Trulicity is a GLP-1 agonist. Tresiba with the Humalog, which is the slow acting. They're like, well, you can't do that. They'll interact with each other. I'm like, no, they won't, doctor. No, they won't. They're the same drug. They just have a different half-life. It will work out completely fine. Then I'm like, doctor, why don't we combine those two compounds with the GLP-1 agonist, Trulicity, to actually get this problem under control? They're like, well, you can't do that because her blood sugar will, become too low. I'm like, doctor, no, it won't. The Trulicity makes the body make its own insulin. Okay, it has a feedback loop. So if it senses the blood sugar is too low, that compound won't let the body secrete its own insulin. The doctor literally had nothing to say at that point in time. So at that point on, I'm like, wow, these doctors are not to be trusted. Anyways, moving forward, we ended up doing that protocol, and now the blood sugar is in a much better state, guys. But anyways, that's all I have to say, guys. Just please be aware of these things. Do not trust people, random people with your health.